If you live with PCOS and you are pregnant or you're looking to get pregnant, this is the video for you. Today we're discussing the wide world of prenatal supplements and pregnancy, and specifically what you need to look out for if you live with PCOS. Hi, my name is Sam. I'm a clinical nutritionist with a special interest in PCOS. Each week I'm bringing you simple, actionable nuggets of information about how you can support your symptoms naturally using the Nourish Natural Health PCOS Repair Protocol. If you like this video, don't forget to subscribe, comment, and like. Let's get into it. So first, let's talk about why prenatal care is so important with those living with PCOS. Due to the metabolic dysfunction of PCOS, those living with PCOS need to take extra steps to ensure that they are prepping their body for a successful and healthy pregnancy. If you are living with unmanaged PCOS and you are pregnant, you are at greater risk for pregnancy complications. Things like gestational diabetes, C-section, and even miscarriage are more common in those living with PCOS. And this is why managing your PCOS is really important. Managing your PCOS will be extremely specific to the type of PCOS you have and the types of symptoms you have. Now, this also needs to be coupled with some prenatal vitamins. And this is because the demands on your body during pregnancy are extreme. I mean, you are growing an entire another human. And that's why a prenatal vitamin is a really good idea to help support you through your pregnancy. So let's talk about what prenatal vitamins actually are. Prenatal vitamins are curated specific nutrients that are contained within the vitamin to provide everything your body needs during pregnancy. There are certain vitamins and nutrients you will find in most prenatal vitamins, and one of these is folate. Folate is an essential B vitamin that is found in food and helps to prepare the body for pregnancy and support the fetus as it grows. So whilst folate is very important in your prenatal vitamin, it is also very important to be specific about the kind of folate that is in your vitamin. There are two types, folic acid and methylated folate. Both are processed very differently in the body. Methylated folate is a superior form of folate, and this is because it's ready to use and doesn't require several steps to be activated by the body. There are other key nutrients to consider in your prenatal vitamin, including inositol and choline. Now, many of these nutrients can be found in food, but because of the high demands of pregnancy, it is a really good idea to supplement. So next, let's talk specifically about how prenatal vitamins can help in the management of your PCOS. So first up, it can help address nutritional deficiencies. Having a specific tailored diet is very crucial when it comes to management of PCOS. However, because pregnancy is so taxing on your body, it can be hard to keep up with certain vitamins and minerals, even if you are eating a well-rounded, balanced, healthy diet. And when your body falls short, it can exacerbate PCOS symptoms. So taking a prenatal vitamin can help correct those nutritional deficiencies. For example, a lot of women living with PCOS find that they will be deficient in iron or vitamin A. And this could be for many reasons, but one of them is just because pregnancy is so taxing. And the next way that prenatal vitamins help with PCOS is it can help with insulin sensitivity. So if you didn't know by now, insulin resistance causes up to 80% of PCOS cases. Insulin resistance is a condition where the cell becomes desensitized to insulin, which actually help to regulate insulin resistance. For example, zinc is contained in a lot of prenatal vitamins and is an essential nutrient when it comes to helping with insulin resistance. The next way prenatal vitamins can help is by balancing your hormones to manage your PCOS symptoms. This is because prenatal vitamins can help to regulate the menstrual cycle and alleviate PMS symptoms. Prenatal vitamins also help to reduce the risk of gestational diabetes. Now, those living with PCOS do have an increased risk of developing gestational diabetes. Prenatal vitamins can help mitigate this risk, which is really important because gestational diabetes also increases your risk of having an emergency C-section, something which we would like to avoid. Next, let's talk about some key prenatal nutrients for those living with PCOS. Number one is ginger. Ginger is hands down the best natural treatment for dealing with morning sickness and nausea. Ginger has no side effects and works directly with digestive tract receptors to help calm and ease queasiness. Next, we've previously mentioned, and that's methylated folate. One of the main things that folate does is help to prevent birth defects. Researchers have found a recommended dose of 400 micrograms daily of methylated folate is the optimal amount before and during pregnancy. Next, as mentioned before, is inositol. This is because myo-inositol and D-chiro-inositol help to improve ovarian function. Myo-inositol specifically has been proven to improve the egg quality in those living with PCOS. It has also been shown to improve pregnancy and delivery rates, which is really important in those with PCOS PCOS because infertility is a common battle that is fought. Next is omega-3 fatty acids. Omega-3 fatty acids help to lower inflammation and also improve insulin sensitivity. And just by managing these two things, your PCOS will be much better managed. The best source of omega-3 fatty acids come from fatty fish like mackerel, sardines, and salmon. If you're plant-based, flax seeds are a great source of omega-3 fatty acids. Next is vitamin D, which is an important nutrient because there is a significant link between PCOS and vitamin D deficiency. And this is because low vitamin D3 levels can be specifically associated with high androgen levels. Androgens are male-like hormones which are responsible for the really pesky PCOS symptoms like acne, facial hair growth, and hair thinning. When it comes to the dosage of vitamin D in your prenatal supplement, it really depends on where your levels are at currently, because you may need a higher dose. So speaking with a professional is key here. Now, we can't talk about prenatal vitamins or pregnancy nutrients without mentioning iron. For some women with PCOS, they may experience prolonged times of heavy bleeding. This puts you at risk of iron deficiency. And because iron is needed in such large amounts during pregnancy, it's really important to correct these nutritional deficiencies before you get pregnant. It's really important to correct these nutritional deficiencies as quickly as you can so that you can have a better recovery after pregnancy. When a woman between the ages of 19 and 50 aren't pregnant, the recommended intake of iron per day is 18 milligrams. But when you're pregnant, the recommended amount goes up to 27 milligrams. This is a huge increase and something that some people may struggle to manage, which again is why it's included in most prenatal vitamins. Chromium is the next nutrient to discuss because it helps to maintain stable blood sugar levels and helps to enhance the effectiveness of insulin, which in turn helps to manage insulin resistance, which, as we heard before, is the cause of up to 80% of PCOS. Next to talk about is choline. Choline is another vitamin that is critical for the development of the fetus, specifically the brain. And even though it is such an important nutrient, it's often not included at premium levels in many prenatal vitamins. And insufficient choline during pregnancy has been linked to developmental delays. So as you can see, it's really important to make sure your prenatal has optimum levels of choline. Okay, so now we know what nutrients we're looking for in a prenatal. Let's discuss factors to consider when you're choosing your prenatal. First, you want to look at the nutrition content. For example, you want to have a look at the type of folate and ensure that you're getting methylated folate. We also want to be looking at how much vitamin D is in there and also making sure that there's an optimal level of choline. And then specifically if you have PCOS, you definitely want to have a look at inositol and make sure that there is a ratio of myo-inositol and D-chiro-inositol. This is specifically beneficial for those living with PCOS. The next thing to consider is quality and purity. It's important that you don't just go for any old prenatal supplement. You want to make sure that you research and choose your prenatal from a brand that you trust. We want to try and make sure that we're choosing one that has been third-party tested so that we know it's gone through the rigorous testing it needs to be safe. And lastly, when selecting your prenatal vitamin, be sure to keep allergies in the forefront of your mind. And this is because if you have PCOS, it's likely you also have food intolerances or allergies. Make sure that you're considering these when you're checking the ingredients of your prenatal and checking to see if any of your allergens are bolded in the ingredients list. And if you are looking for a PCOS specific prenatal, we have an amazing one here at Nourish Natural Health. The Nourish Natural Health Nourish Mama Prenatal is the perfect prenatal for those looking to get pregnant and living with PCOS. It is meticulously formulated to meet your preconception, pregnancy, and postpartum needs. The prenatal includes 27 vitamins and minerals, all formulated in specific ratios to benefit you and your PCOS management. It also nourishes the body postpartum and supports lactation, which sets you on a path to have a successful breastfeeding journey if that's what you're after. Our blend is a vegan formulator with high-dose choline, methylated folate, and inositol, amongst so many other beneficial vitamins and minerals that you need in a prenatal supplement. And just as an added bonus, it also has ginger in there to help with any morning sickness that arises. You can head to the Nourish Natural Health website to check out our range of supplements and specifically our Nourished Mama Prenatal. So now you know how to find the best prenatal, let's talk about when you should start taking it. So ideally, you want to start taking a prenatal supplement 3 months before you get pregnant. And those 3 months will give your body time to use the vitamins to produce higher egg quality. It's important to continue taking your supplements into pregnancy as well, specifically the first 12 weeks. And even after that, it's a good idea to continue to take your prenatal for the rest of your pregnancy. And this will help prep your body body for the postpartum period, as well as helping to correct any nutritional deficiencies that you may pick up during your pregnancy. It's important to monitor your vitamin intake with your healthcare provider because you may need to adjust the dosage or the ratio as your pregnancy moves forward. So as we've seen, a prenatal supplement is key to a healthy pregnancy, specifically with those with PCOS. What has been your experience with taking prenatal vitamins? We'd love to hear about it. Leave us a comment and let's discuss it. If you have experienced pregnancy before and there's anything you've done that's really helped the process, leave it in the comments below because we'd love to hear about it. And if you're looking for more information on our vitamins or pregnancy and PCOS, make sure you head to the Nourish Natural Health website where you can find our community and even a quiz that you can take to find out what the root cause of your PCOS is. If you like this video, make sure that you hit the like button and you subscribe and turn the bell on for notifications so you don't miss the next video. And I will see you in the next one. Bye!